today we're going to look at fractures and how those fractures will actually heal. So if you ever have broken a bone of any kind before, then that is a fracture. So here you can see actual bone right here in this image. This would be muscle around it and then the skin. So a fracture is simply a break in a bone, and there are types of fractures or kind of categories of fractures. So you can have multiple terms to essentially describe a particular fracture. First, we have either a fracture can either be closed, or another term for that would be simple, or it can be open or compound. So open or compound are synonyms. If a fracture is closed or simple, that means that the bone ends where it's broken do not go through the skin at all. If a fracture is open or compound, then the broken ends would penetrate or go through the skin. So you can see here we have broken bones, but they're not coming out or protruding through the skin. And here, so this would be closed or simple, and then this would be open or compound. So you've got that nice little piece of bone coming through the skin there. A fracture can also be displaced or non-displaced, and that same fracture that could be closed, simple, open, or compound could also be displaced or non-displaced. So displaced means that the broken ends of the bone are out of their normal position. Non-displaced means that they are broken, but it stays in their normal position. So this would pretty much be, we said before, it was closed or simple, and that would also be non-displaced because the ends are not out of where they should be. They're still lined up pretty normally. This one over here, we said that it was an open or compound fracture. It also is a displaced fracture because this end of the bone is all the way out here, and it should be over here. And then that same fracture can also be complete or incomplete. So complete, the bone is broken all the way through. So this would be a complete fracture, as with this. Same with over here. Incomplete would be that the bone is broken, just not all the way through the entire bone. If we look at some stats about fractures, fractures in your extremities, so your arms and legs, are the most common. If you think about that, usually if you're going to fall or something, you'd usually try to catch yourself with your hands or arms. So it's going to make fractures in your extremities more common. In men, fractures are more common up to age 45. I always think that can be attributed to men/boys kind of doing stupid things or being daredevils and kind of doing things that would get them injured. For women, fractures are more common after the age of 45. So that's kind of around the age typically of menopause, when they stop producing as much estrogen or progesterone, and that's going to cause their bones to start to weaken as they age. Before the age of 75, a wrist fracture is the most common kind of fracture. After age 75, hip fractures become more common. So if we look at types of fractures, so with what we talked about before, this information that we had here, you can have all of these like 3 sets of terms describing the same fracture, and each of those could be related to a kind of fracture that we're going to go through now. We'll practice using those when we do our x-ray lab tomorrow. So tomorrow we're going to be doing a lab where we are examining different kinds of fractures and x-rays. So you'll kind of see how to do that a little bit more then. So the first type of fracture we have is a transverse fracture, where the fracture is perpendicular to the long axis of the bone. So you can see right here, the fracture is pretty much straight across the length of that bone. On your notes, you also have a circle kind of offset from the x-ray. So please make sure you move that circle over top of the x-ray to identify and make it easier to spot where that fracture is. A transverse fracture is usually caused by a force directly applied to the fracture site. So, for example, if somebody were kicked really hard in the shin, that direct force might cause a transverse fracture. A lineal fracture is going to be the fracture when it's parallel to the long axis of the bone. So we have that right here. Again, make sure you circle that on your x-ray. An epiphyseal fracture is when the epiphysis, or the end of the bone, separates from the diaphysis along the epiphyseal line, or that remnant of our growth plate. This one you don't need to circle anything because there are arrows on those x-rays for you already. A depressed fracture. So this one just it makes me cringe. But the broken bone is pressed inward, so make sure you circle that again on your x-ray. A spiral or oblique fracture, they can be kind of used interchangeably. It's going to be, we can see one right here on this x-ray, and then you've got 3 circles on your notes. So make sure you circle all 3 places where you can see the fractures on your x-ray on your notes. So it's going to be a ragged break when the bone is excessively twisted, like maybe you get your foot caught in a hole when you're walking outside and you kind of fall and you're twisting as you fall, like your body twists as you fall. That can cause a fracture to be that spiral or oblique fracture. So those are going to be kind of on an angle. You can see here we have the tibia and the fibula. So the tibia is fractured here. The fibula is fractured up here. And again, you can see that here. So if it's on an angle, essentially it's going to be a spiral or oblique fracture. A green stick fracture. This would be incomplete, meaning it's not all the way through the bone. Green stick fractures only occur in children. So an adult cannot have a green stick fracture. The reason for that is a child's bones are still soft. They haven't fully ossified yet. And so they're going to bend, but they don't actually fracture completely. So here, if you're looking at this x-ray, you can't really tell, you know, if there's any fracture. But from the side, you can kind of see a bend that's there. If we look here, you can see that it started to fracture a little bit, and make sure you circle that on your notes. But it's not completely through. It only goes till about here because that bone or those bones just bent. Compression fractures. These are going to be more common in elderly people just because osteoporosis is more common in elderly people. But it can happen in younger people as well. So this is just a common fracture for people with osteoporosis with weakened bones. It's going to be a fracture in like spongy bone, and it's a result of compression. And what happens is the bone is crushed. So again, you don't have circles for this one because there are arrows for you, but you can see how these vertebrae are kind of big on either side. And this one, you can see it's much smaller because it was compressed and crushed. An avulsion fracture. This is going to be where a piece of bone has been torn off by a ligament or a tendon. So make sure you circle that on your notes so you can kind of find that a little easier. If you had me for Anatomy 1, you probably remember me telling this story, but I'll tell it again. There are certain injuries that are kind of more common, and a common form of an avulsion fracture is called a ring avulsion, as in the kind of like a ring you would wear on your finger. Jimmy Fallon actually had talked about it on his show. It happened to him. He was in his kitchen and stepped on, like, I guess, like an area rug or like a kitchen rug, and he slipped, and he went to try to catch himself on his kitchen counter, but he went to catch on with his left hand where his wedding band was, and his wedding band got caught on the counter, and it kind of stripped his finger. So it kind of stripped the muscles and tendons and stuff away from the bone, and then pulled some of the bone off with that. So if you ever do watch his show or see him on anything now, pay attention to his left ring finger, because he doesn't have like full range of motion or control over it anymore since he had this injury. He had to be in the hospital and have surgery to repair it. But just an example of an injury that can happen that would be an avulsion. A fracture, dislocation, or subluxation. It is still considered a fracture, but this fracture would involve a joint. So the joint surfaces, those articulations are out of alignment. So here we have a shoulder dislocation. Make sure you circle that on your notes. Next, we have a comminuted fracture. These are pretty gnarly. The bone's going to be kind of shattered almost. So there would be 3 or more pieces. Okay, this bone right here should be the femur. and you know how long the femur should be, and you can see how short it looks here. Because we'd have the patella right in here in the front. Here's the tibia and fibula down here, and this would be the pelvis up here. So here's the ball and socket joint at the hip. That's the top part of the femur. Here's the bottom part of the femur, and then here's the middle part of the femur, totally separated from the rest of it. This would be more common with like a high energy trauma, like maybe a car accident or something along those lines. With a comminuted fracture, because the bone is going to be in multiple pieces, like more than 2 pieces, usually there needs to be some kind of surgery to repair that, and there would need to be hardware put in, like screws, rods, or plates that you can see here. This is an x-ray of someone who has like pins and screws and stuff in their bone. That metal would show up on an x-ray. Next, we have a stress fracture. There are a couple kinds of stress fractures. One, which is called a fatigue fracture, is caused by just having abnormal stress on a normal bone, like the bone's healthy, but just having abnormal stress put on it can cause a fatigue fracture. If the bone is abnormal, just the normal everyday like use of that bone can cause what we call an insufficiency fracture. You can see that kind of here. Make sure you circle that on your notes. And the way we diagnose and treat fractures is going to be what we look at next. So typically how fractures are diagnosed are by an x-ray. It's going to localize the fracture, so it's going to like find where the fracture would be, as well as the number of bone fragments that are there. It can show any degree of displacement. It can also show if there's some kind of pre-existing disease in the bone, or if the bone is normal as far as the health of the bone. Any foreign bodies that shouldn't be there, if there's air in the tissues. And it could show other fractures that you didn't even know were there, or fractures that maybe were there and then healed, depending on how long before that it was. If there was soft tissue damage, then person would need to have an MRI, a CT scan, or an ultrasound to see that, because the x-rays will not show soft tissue damage. So typically a fracture is going to require some kind of reduction. There's both closed and open reduction. Closed reduction is basically putting the bone back together without surgery. So they were able to realign the bone. You might get a cast, but they don't actually need to do surgery to get the bone to heal properly. So that's closed reduction. Open reduction is when there's surgery required to fix it, to put the pieces of bone back where they belong. For as far as holding the reduction, there's external fixation. That is when the fracture might be too unstable for a cast, and that would look like this right here. Internal fixation would be what you see here, when rods, screws, or plates are placed surgically to hold the bone in place. Those are then left in typically. And then a frame fixation, if you have seen the movie Mean Girls, Regina George winds up with an external fixator around her head and spine to keep her from moving after she's hit by a bus. That's a frame fixation. So that will allow for deformities to be corrected. And the way it happens is, or like where you could straighten the bone, is there's little pins in here, and you have to rotate them or like spin them a little bit each day. And that over time gets everything to kind of straighten out and heal properly. There's also traction. So you can see if somebody is quote unquote in traction, this is what it would look like, where there are fractures or dislocations that require slow or long-term healing. For the fractures to heal, okay, the first thing that's going to happen is that there's going to be a hematoma forming at the site of the fracture. The site's going to become swollen because blood vessels have been broken there. It's going to be very, very painful. There's going to be inflammation, like just all that general swelling. And that's going to happen within 6 to 8 hours after the injury. Where the fracture occurs, those bone cells are going to die. So there's going to be swelling and inflammation of those dead bone cells. For about 3 weeks after the fracture occurs, there's going to be something called a fibrocartilaginous callus that forms. And that is for, again, about 3 weeks after the fracture injury. So what needs to happen is new capillaries have to organize the hematoma or the bleeding under the skin into what we call granulation tissue or a procallus. Your fibroblasts as well as osteogenic cells are going to kind of invade and move into that area. And then those chondroblasts are going to start to produce fibrocartilage. Because if you remember when we talked about how bones form, they have to form from a cartilage model. So we need to get some more cartilage in this area first before the bone can actually heal. After about 3 weeks, it lasts for about 3 to 4 months, you're going to have a bony callus that forms. And the osteoblasts, remember our bone building cells, are going to make woven bone in that area. And then the next thing that happens is that bone remodeling will begin. And that process we talked about in our last lesson. So compact bone will be laid down to kind of rebuild the shaft walls of the bone. The osteoclast will remodel the woven bones. They're going to break it down so that it can be rebuilt into whatever shape it needs to be. And then after enough time has passed, you might not even see a trace of a fracture on an x-ray. So if there's been enough time that has passed for the fracture to fully heal, you often don't see previous fractures on an x-ray at all. And then here, our last thing that we have is just another picture. So again, you just have a blood clot, you get the callus to form, eventually it's replaced with cartilage, and then you get that bone built from that cartilage model in that area so that your fracture is healed.